Thanks, Greg. I'd like to extend a couple of points that Greg had made, and with the time available, I want to address these 2 points. One is just the next generation broadband network that has been put in place to support PMHA's new capabilities, and give you a sense of what that provides. So as we think about the stimulus monies, we think about expanding broadband through the state. We're doing it with the latest, greatest technology, and continue to push the ball forward in Pennsylvania. And then the second point is to look at the additional healthcare projects that have occurred around the state. There are 5 others that have received the same FCC money, and specifically to look at the lessons learned from that acquisition process of those funds. As we think about this stimulus package and how it's going to be deployed, I've got a specific call to action for this group that I'd like to summarize with. So this is Sting's broadband network that has been put in place in the state of Pennsylvania over the last 3 years. We've invested over $25 million building out 2,000 miles of fiber, state-of-the-art carrier Ethernet, what's called carrier Ethernet switches that allow for wide area network connectivity. And did anyone come down 2nd Street today to come to the meeting, run into some traffic on your way in this morning? That would be an old telco network equivalent analogy of a circuit switched, limited lanes. You got to wait out the traffic, get here when you get here as the traffic moves through to the Hilton. The network we have built is equivalent of a 12-lane, infinite deck, multi-high occupancy vehicle lanes available to you on demand as you need them. And so that's the kind of network that PMHA will have as of July of this year that will allow for real-time, anywhere-to-anywhere, point-to-point types of connections that can be dialed up on demand. And so if you have a teleradiology application, you have a telepsych need where you're doing a video conference, you have data backup recovery requirements, that network will respond on the fly with 100 megabit minimum speeds up to a gigabit capable in the network. And so that is what is now available in Pennsylvania, and we continue to see that expand through the state. We have about 47 to 67 counties covered now, and originally built this network on the backbones of the state project for connecting the educational institutions, the K-12 public schools. We have 29 intermediate units connected around the state, serving the 501 school districts on that same 100 megabit type service. And so as you think about the healthcare opportunities that expand some of these projects, we'll tap back into the educational networks and allow us to share data across that, educate students, connect them to nursing programs, other types of opportunities will expand as these networks get built and we create interconnections. The benefits of this particular network, moving from that circuit switch world to actually an internet protocol-based network, commonly referred to in the industry as a converged network. This is where you have the ability to deliver voice, data, and video over the same connectivity, over the same facilities. And so as your applications require it, you have the ability to provide that scalable bandwidth. We're calling the concept that has hit the IT shops of data virtualization and leveraging hardware can now happen with the network. And you have the ability to virtualize that network and put multiple customers on that same facility. So if you have a community healthcare network, as was described in the prior presentation, you have the ability for a hospital, a physician's office, an imaging facility, pharmacy to share that same network connectivity, but have secure data paths on that facility, protect their data from others that are isolating that traffic, and be able to get it to where it needs to get to. And that's the beauty of an IP network. It also provides for the ability for these applications. The earlier presenter that spoke of the FIX, the Pennsylvania Health Information Exchange, the idea that we can put these applications out in the network, cloud computing as it's referred to, and distribute the applications is a much more cost-effective way to build our IT infrastructure for healthcare in the state. And so whether it's Sting or Verizon or AT&T or other carriers as they move forward, Comcast as well, starting to move to this type of network, we have the benefit of Sting, and we've just built this over the last 3 years, so we don't have a lot of the legacy infrastructure, but have done it specifically on the current technology. And so we see a lot of cost savings as a result of that. We're able to deliver this 100 meg and gig bandwidth service at about 40% less cost than the previous networks that have been provisioned. So quickly, I want to give you an idea of the FCC vision for rural health care and what happened, as Greg mentioned, a year and a half ago in funding these projects. They were specifically targeted at the issue of electronic medical records and building the connectivity to allow EMRs to be shared for all the benefits that we know, and this group knows quite well, and deploy the underlying broadband infrastructure that would connect the facilities. This is the scope of that on a national basis. As was mentioned, $400-some million was set aside by the FCC to provide for these programs. And you can see in Pennsylvania, it's not only to connect projects like Greg's Pennsylvania Mountain Health Alliance, but to interconnect then eventually, the goal and the vision is PMHA could connect to Geisinger, could connect to Hershey, could connect to University of Pittsburgh Medical Center, to the Philadelphia facilities, as well as to Mayo Clinic, Johns Hopkins, others around the country, that would provide for the best expertise at the right time for the patient in need. And so these large-scale applications connecting the facilities, as well as small-scale networks within the community, and really, because of the nature of the rural grant, get the support to the rural regions of the state. And this is the statistics around the number of healthcare centers and the number of states that are involved in providing that connectivity. These are the additional Pennsylvania projects. There are 5 others. Geisinger Health System received close to $1 million to connect 15 facilities for high bandwidth radiographs and electronic record system. Junior Valley Network in Lewistown has over $3 million of funds available, and there's some things happening there that are going to expand their connections and make that part of a broader network, but they've got significant resources to embark on that connectivity. We also have Northwestern Pennsylvania with a little over $300,000, and the Northeast Health Net Initiative, which interestingly, we start to think about networks and what they allow, they break down barriers. And so these somewhat artificial state barriers that exist in terms of the ability to get access to the best medicine begin to blur. And so when you look at the borders of Pennsylvania, this project is to start to break those borders down. And New York healthcare facilities that border the state line will be able to share resources and start to provide that expertise, because a lot of times the people in those communities, they don't look at that state line as they think about their health. They cross that and go to where the best care is geographically available to them. And so this network is to help break those barriers. And then finally, Hershey Medical Center has about $894,000 available as well from an academic research perspective on this project. So $8.2 million of total, if I did my math right, out of $400 million was received from Pennsylvania from the FCC for these grants. That's 2%. If I again did my math right, Pennsylvania has 12 million taxpayers in the state out of 300 million in the country. So I think that figures about 4%. So we left $8 million on the table, from my perspective, of what we should receive as a state for these funds. And so as we think about the stimulus package, and if anyone has read that, 1,100-page document, great nighttime reading, keep it next to the bedstand. That document has over $20-some billion, the 19 that was mentioned earlier for healthcare IT initiatives, as well as $9 billion for broadband that are being made available. I went to a session last week in Washington, D.C. There must have been 50 other sessions going on at the same time. The thing that was amazing to me out of that session was we still don't know the rules of how this is going to be developed and how it's going to be spent. So Kelly, my call to action to this group is specifically in 3 areas. I would like to see a subcommittee of our group basically put together to address the tracking, the influence, and reporting on the stimulus rules for this money that is being made available. I'd also like to see us leverage the membership here of PHIE into lobbying our legislators for their action and activity to make sure that we're in the right place at the right time for these funds. And also, the third item is to make sure that we develop specific shovel-ready health IT projects. Because one of the things that's clear from both the FCC money as well as the health IT projects is those states, those organizations that are best organized to make the request, to have viable projects, have them identified, have them documented in terms of the benefits that they'll bring to the state, will receive the funds. And so it's, I think, incumbent upon us to make sure that we don't get 2% of that 27 billion for these projects, but we get our 4, maybe 6% share of that. So that's a request that I have, and look forward to be available to talk to anybody regarding that and how we continue to organize our activities around that. Thank you.